You have arrived at phase 3, nitty gritty. That's what I'm calling this one for advanced direct. When you've got your form and you are ready to make those decisions, first of all, you need to be coherent. So we don't need to wait. You can always change this form, or the person that you are designating. You need to sit down and have a frank conversation, like when I look like this, or when this is going down, or whatever the case may be. Like if it gets worse, or if there's signs that you're seeing that I am not going to recover well. This is what I want done. A, B, C. It has to be talked through. You've got to have that firm conversation with the person you're designating. You need to trust them that they are going to make the decisions for you. You really need somebody who does love you so much that they can make those hard decisions, even though they may want something totally different than what you're wanting. Let's get into the form. What most forms will ask you. First thing is usually pretty cut and dry. Do you want a do not resuscitate order or CPR? That's pretty much basic. There's nothing to be done. It really comes down to what you want. And I'll just be honest, coming from a healthcare field, I have seen the goods and bads of continuing life support. There's been really good outcomes and there has been sad outcomes. The point being is make that decision now while you have your wits about you, and make sure that person that you're designating as your representative knows exactly what you want. CPR, that is chest compressions. That is a life-saving measure that will begin if you choose that. You can actually have a variation of this, so you can have chest compressions with no intubation. We'll get into intubation later. Compressions are going to keep your blood flowing by somebody manually pumping on your chest. Most likely your ribs will fracture. That is the case in a lot of situations. It's just if you want that measure. It's completely up to you. Another variation that a lot of people elect is to have the CPR but do not intubate. Intubate is the plastic tube that they will insert down into your lungs and breathe for you. It depends on what you want. Some people do not want that. That is your choice. You can also have no chest compressions. You can have a little bit of airway support. You really can tailor it to whatever you want, whatever your preference is. Now, a lot of times there is such a thing as DNR, like do not resuscitate, limited interventions. Again, I like this one sometimes if you don't want things to be so final. Sometimes you feel really good when you make these decisions, or when you come into hospice care, it's not at the end of life. So you really can't think, man, do I really want to absolutely this be final? So there's limited interventions option. This one is nice for if you would like to be treated for like infections, or you want a little bit of IV support, things like that. Limited interventions means just that. You can go to the hospital and get a few little things done. It's not like an end all be all. Some people are just sick and tired of going to the ER in and out all the time, and they do not want anything. Like whatever happens, happens. They are at peace with it and they want comfort measures only. So now we're into the piece where it talks about artificial nutrition. You have to make the decision. If you do not want feeding whatsoever, there's just a no. Then there's also an option, a nutritional feeding for a defined trial period. Some people do choose this one if there's ever a chance that they do go under for some reason and they need that nutritional support. And then there is long-term nutritional support. There's pros and cons. You have to decide, what do you think is your preference on artificially keeping you fed? And that's another conversation that you have with your doctor. Sit down and talk about, what does it look like if I do the long-term feedings? What does it look like if I don't? You're going to recap all of these things with your nurse or your doctor that you're speaking to if you're in the hospice program. But this thing, if you're going to make some of these decisions maybe outside of hospice, you can make these decisions and make these directives clear cut for the person that you are going to be designating as your representative. You drive the bus. Even if you make this form, even if you fill out the advanced directives, if you're alert and oriented, that is still your decision. They do not take over your care at that time. A lot of people think, well, if I sign this now, I have no say-so, and that is not the case. They are only there. Your representative is only there in the event that you cannot speak for yourself. Over this form, think about those options and see what best fits for your life right now. I hope this helps. I hope this gives you a new understanding of what that advanced planning can do for you and your loved ones. It makes a world of difference.